Willie Rennie to be followed by Neil Findlay.
The Health Secretary knows that I've sought to be constructive throughout this whole pandemic. But I have to say this whole episode of 125 outbreaks, turning into 908, with 218 tragically dying, has shaken my confidence in what the government is telling us. But what I want to know is what this means for restarting non-urgent operations in hospitals. Are the government on top of this, or will these people have to wait even longer?
Cabinet Secretary.
So let me explain the way in which the health boards report on suspected hospital-acquired infections is on the basis of incidents. And an incident is a case as 2 or more cases. So there was no attempt to dissemble here. That's how it's reported. That's how the information comes in. That's what was reported. And as soon as the question was asked, how many people might that have involved, the information was given straight away. There was, again, no attempt to dissemble. So Mr Rennie is absolutely right, and I am grateful to him. He has consistently, as have his colleagues, attempted to engage constructively, and I hope he feels that he's had a constructive response. But I don't think that what has happened here, where we are talking about suspected cases, unvalidated data, made crystal clear in every answer that has been given on this, can then be described as turned into that number of cases, that number of deaths, because we do not know that yet. We will know it when the data is validated. Now, in terms of what does this mean, though, in nosocomial infection and how patients might feel about the restart of the NHS, I think when I spoke last week in the debate on the framework for decision-making, I recognised Cancer UK's example and their request that patients should feel they had a safe place, a safe area, and that in part would be met by the testing of staff. There's also discussion underway by clinicians about asking patients in elective surgery in particular to self-isolate for 14 days before the date of admission. So all of that work is already underway in order to ensure that we offer patients and staff the safest possible route to the remobilisation of our NHS. And again, in what was said in the framework and in the debate, I talked about doing this safely. And safely is for both staff and for patients, and it will involve all of those measures I've already outlined.
Neil Findlay.